Osteoarthritis is traditionally seen as a natural part of the aging process rather than a disease. But our team has found that there's an important cause and a cure for it. We can now reverse what was once thought to be a natural and irreversible process of degeneration. 20 years ago, we found a specific cause for osteoarthritis. After a series of rigorous research and more than 10 years of clinical validation, we learned that this particular cause is the key for the progressive cartilage degeneration of the knee joint. As the majority of people regard osteoarthritis not as a disease but a degenerative condition, most treatments available only relieve the symptoms. In my opinion, alleviating pain only masks the condition, allowing the disease to aggravate and causing the patient to miss the opportunity to be cured. We adopt a natural approach of prevention before it even begins to develop. And if it does develop, we also have a relatively natural method of curing it by removing the cause of the disease. Our treatment is called the Knee Health Promotion Option. The first stage is the prevention of osteoarthritis for people with healthy joints. Based on our research on the causes and development of the disease, we have developed a comprehensive program for knee protection called New Hope for Knee Osteoarthritis. Once clinical symptoms appear, we conduct surgery with an arthroscope to promote cartilage regeneration. And at the third stage, which is the stage in which disability occurs, the joint is already seriously deformed, so we perform a joint reconstruction surgery. Based on our most recent and complete follow-up data, we found that as much as 95% of the patients are satisfied with our treatment. Not only does this treatment help patients who have knee pain, it also helps to prevent osteoarthritis for the vast majority of people who don't have symptoms. We offer 3 different solutions for the prevention as well as the treatment of the disease, so its projected economic value is very high. For medical teams who are interested in our treatment, we offer a comprehensive technology transfer program. First, we start with the training of professionals. Second, there's the transfer of key technology, such as arthroscopic surgery for cartilage regeneration or artificial joint replacement. The third part is the installment of equipment and the integration of know-how. Last but not least, we have a period of assessment and evaluation designed to achieve quality assurance. Freedom of movement is the basis of an active and healthy life. For more than the past decade, our Joint Center has helped tens of thousands of patients regain mobility. Our treatment has also been shared with various medical units in Taiwan and other countries. In the future, we hope to work together with local biotech companies to create a comprehensive and holistic model of care designed for everyone.
像这样比较创新的疗法是
This innovative treatment has been developed by Dr. Liu, who has worked very hard for many years to persuade other researchers to accept his new approach. In the past, elderly patients had to travel long distances to Dalian Tsuji Hospital to see Dr. Liu. And they often had to stay in queues for months or even half a year to receive follow-up treatment. With the setup of the Health Promotion Center of the Knee in Taipei Tsuji Hospital, the public in the greater Taipei area will benefit directly because they'll be able to receive the treatment and services of Dr. Liu and the orthopedic team at our hospital without the arduous journey.
So I was really excited to come over here to see his procedures. So I attended with him the procedure, and he taught me the procedure properly in the theater. And I got the chance to see the follow-up of the patients in the outpatient clinic, which most of them, they came with good feedback and they are happy and satisfied. So I came all the way from Abu Dhabi, from my hospital, An-Noor Hospital, to Taiwan here, Dalian, just to give more chance to my patients to get more chance for better treatment.
Our team is responsible for developing a smart knee pad and verifying its functions. We created a prototype complete with circuit and algorithm design. The initial concept originated from Dr. Liu. Since many of his patients had not followed through with physical therapy after surgery, the intended effects of the surgeries could not be fully achieved. So since many years ago, Dr. Liu had wanted to develop a knee pad that can detect the angle of the knee joint. And now we have such a device, so we can record data of the knee joint, namely how many times a person's joint has flexed in one day, the angle that the joint was flexed each time, and whether each angle will damage the joint or not. These are critical data for physical therapy of the joint. Our team at the Institute for Information Industry plays two major roles in this project. First, we've created an online platform. As providing information alone is not enough, we hope to provide a platform for the general public to learn more about the knee joint, how to care for it, and even make inquiries. Secondly, we hope to use information technology to support and improve the patient's physical therapy process after surgery. So we've been collaborating with another team to create innovative applications to offer a different approach to the traditional methods of physical therapy.
In physical therapy, oftentimes what's most important is the number of exercise repetitions that patients need to reach. This is often boring and reduces the patient's motivation. So we've developed a product with games that guides patients through repetitive exercises in their homes to make the process more enjoyable. The traditional method of making regular visits to the hospital for physical therapy can be challenging for patients because it takes time and transportation costs. And from the perspective of the medical staff, they would want to track the follow-through of the patient at home, such as knowing whether the patient has performed the prescribed leg lifting exercises for 10 times or not.
For more than a decade, we've been hoping to share this wonderful treatment with the orthopedic community. But we found that in a well-established field, a new approach can be extremely hard to be accepted and must go through a long period of verification before it can be approved of. The main reason that keeps us going is the joy, the smiles, and the satisfaction that our patients share with us on a daily or weekly basis. Their appreciation and satisfied feedback is the driving force behind our team.